In South Africa, among the nearly 8 million people living with HIV, about 5.7 million of them are on treatment, leaving a gap of over 2 million people who should be on treatment but are not. Even with the range of treatment and prevention options, there have been notably new infections. And it is troubling that statistics shows that young people between the ages of 15 to 24 are particularly vulnerable and at risk of contracting the virus.
When you had to start treatment, you needed to have a CD4 cell count of less than 200. But now we have test and treat, where when you're tested today, you're giving antiretroviral treatment today.
In South Africa, the government has prioritized providing treatment to those who have HIV, and antiretroviral treatment is free to anyone who tests positive, no matter the CD4 counts. Officials are also ramping up efforts to encourage medical male circumcision and the prevention of mother-to-child transmission.
Is one huge challenge that the future of antiretroviral treatment is going to face: disengagement in care and the return of AIDS-defining illnesses to Africa. We need a collective effort from the community, from people living with HIV, from scientists, from program implementers, from policymakers on how we're going to do better at engaging people in care.
Health officials report that the strides made in fighting HIV have given rise to new hope, but the fight is far from being over. The dangers of HIV remain real, and the disease continues to ravage through families and communities with consequences for future generations. They urge the population to take responsibility for their lives and, in the spirit of Ubuntu, take the necessary preventative measures to prevent the further spread of the disease.